Okay, so this is part 3 of our labor and delivery theory course. I'm Christy Dellenbach in my home office in my old scrubs, isolating for COVID. All right, that's the intro. So I want to talk to you about cervical change in labor and delivery. Um, so cervical dilation, most people kind of can wrap their head around that. We already talked about at the end of the first trimester how the cervix begins to get softer, how people may slough the mucus plug, which is that protective plug within the inner os of and in the cervix before she starts dilating. It's the plug that keeps the normal bacteria from the vagina from traveling up into the uterus. So I'm going to show you this little chart on cervical dilation. This is 1 centimeter dilated. Cervical dilation is measured in centimeters. And I know that one of my fingertips does fit in 1 centimeter cervix. You can also measure your fingertips to see kind of what they are, but you'll get a sense of it after you do a number of vag exams. I know that two of my fingers fit like this in 2 centimeters, and then 3, they're spread a little bit. Remember, this is a blind exam. So one practitioner might go in, examine the cervix, and come up with a number that varies from yours. If it's drastically different, the two of you need to collaborate. But people generally kind of have a way of checking. Some people check a little small, some people check a little big. That's kind of how it goes. 5 centimeters, 6 centimeters. Once I get to 6 centimeters, I also sort of measure how much cervix is left, because you get up into the bigger numbers and it's a little bit harder to tell. When the cervix is completely dilated, or we call it 10 centimeters, but complete is just the amount of cervix dilation that it takes to get around the baby's head. So if you imagine that the cervix is sort of like a turtleneck sweater that has to come over the baby's head, once it's really past the widest part of the head, unless you really dig deep, you don't feel any cervix at all around the baby's head, and that's completely dilated, or 10 centimeters. It might be more than 10 centimeters if you have a really large baby, or less than 10 centimeters if it's a small baby. When I feel like there's kind of a half a centimeter around all the way, it's kind of a rim of cervix. That's kind of 9 centimeters, because you've got a half here and a half here sort of thing. Sometimes the cervix pulls back from the underneath side and across where the symphysis pubis is. The little bit sort of gets hung up there before the baby goes under the pubic bone, and sometimes you'll just have some like from 3 o'clock to 9 o'clock position, or 9 to 3 o'clock across the top. We call that an anterior rim, just across the top, just a little bit hanging on. In general, patients don't start pushing till the cervix is completely dilated. Sometimes patients will push a little bit if they have the strong urge, but in general, if you start pushing too soon, the cervix can become a little bit swollen from the pressure on it. Plus, it wastes our energy. So anyway, that's a dilating of the cervix. And I think most people kind of get that. So I'm just going to show you how the thing that some people kind of have trouble with is the effacement of the cervix. So if we again imagine this is our cervix, it might be around 4 centimeters, maybe even up to 5 centimeters on a person who is not in labor. Uneffaced cervix might be 4, maybe even up to 5 centimeters dilated. But in general, we can call it maybe 4 centimeters long. So maybe not quite as long as this. Effacement is the thinning out of the cervix. So it's as the cervix kind of pulls up behind the baby's head, The effacement of the cervix is what the amount of cervix that's pulled back compared to what's left. So if we think that the cervix is, say, 4 centimeters in length, and 2 centimeters of it is already pulled up behind the baby's head, and you go in and do your vaginal exam, and you can feel that there's 2 centimeters width in front of the cervix, that's 50% effaced. As the cervix gets pulled up further and further into the uterus, towards the uterus, I should say, up over the baby's head, this becomes thinner and thinner. And 75% effaced means that 75% of the cervix is behind the baby's head, and all you have left is 25%. So you go in and examine the patient, and you can feel, oh, I only feel a little bit of his cervix. It's about 25% is in front of the baby's head. 75% is back here. So she's 75% effaced. When she's completely effaced, all of the cervix is basically pulled back, and there's just a very minute amount left encircling the baby's head. Sometimes this cervix can be so thin, it's easy to miss. It's almost like the thickness of paper. It can be so thin. So you really have to kind of gently check to make sure you're not missing the cervix. And then once it's pulled back, of course, it's completely effaced because it's 100% back and it's 100% dilated. Now it's time for mama to push and greet her baby. All right. Let's look at a couple of cervical models that I have. And I'm adding some of this clinical information since you don't get to go to clinical this quarter. I thought I would throw some of this information in here. Let's look at a model of a cervix. You would be checking the cervix with sterile gloves on in the clinical environment, but we're just going to pretend these are sterile gloves. And we've got a model of a cervix here. So this is an uneffaced cervix and a long, thick, and closed cervix. And this is probably about the size of a real cervix. Of course, it's facing downward or a little bit forward if the mom is laying on her back when you're checking. And this end of the cervix here is about all that protrudes into the vagina, like as the rugae of the vagina are loosely around it. But the actual length of the cervix is about 4 centimeters. And you can see in here, this is an uneffaced cervix. So the baby's head might be cradled in here and working to dilate and efface that cervix. So this cervix, if you went in and found this cervix on the mom, you would call this closed, or maybe a dimple. Some people like to say that, or some people say a fingertip if they can just get one little fingertip in. But basically, this cervix is closed. Let's look at a cervix that is starting to open a little bit. I have a model here of a cervix that's 2 to 3 centimeters dilated. So you can see how this cervix is much more dilated, and I'll just show you here. I've got a ruler with centimeters on it. You can see here that I don't know if that's in focus, that cervix is starting to dilate. So we've got 2 to 3 centimeters, and if I can check the cervix with my fingers like this, then I know it's 3. If it's a tight 3, it grips my fingers. If it's a loose 3, I can easily move my fingers around, and that's my exam with my fingers. But I also want to call your attention not just to the dilating, but to the effacement. If we flip this model over, you can see here that the cervix, the inner side of the cervix, has started to really pull back and efface, and you can see that the length of the cervix has actually shortened. So that's that. Then let's look at this model. We've got a cervix that is a little more than 4 centimeters dilated. So for my fingers, when I put my fingers in, and I can open them about a full finger width from each other. That's about my 4. Now sometimes some people will examine the cervix and they'll go like this, and they go, oh wow, yeah, that's 5 to 6. But do you see how you're just stretching it? And that hasn't really changed what its natural aptitude is. So if you just kind of sweep over it, you can kind of get a sense of what the dilation is sitting at. And you know, if someone before you has done this and stretched out the cervix, and then you come along behind them, and it's kind of hard to tell the patient that their cervix is actually 4 when the last person said it was 5 or 6. And so you can, you know, say, well, by my measurement, it's more of a 4 to 5. But it probably hasn't changed since the other person's measurement. It's nice if you can have the same person examining the cervix over time. It's not always possible, but it's awesome if that can happen. Also, that minimizes the number of checks. The more you can minimize the checks, considering that everything is normal in labor, then you know, we're reducing the chance of bringing bacteria from the vagina that normally is there up into the cervical area, especially if the membranes are ruptured. If we flip this over, we see that this is quite effaced now. There's only a small thickness left on it, so this is like 90% effaced. There's just a little tiny bit, very tiny bit left on that. I don't know if you can see it for sure, but that's about 90% effaced. Another thing that we talk about with the cervix is its softness. So when the cervix is doing its work of keeping the baby in, it's long, thick, firm, holding that baby in. When it's time to deliver, it has to soften, it becomes pliable, and that of course helps it dilate. Now in the primate, having the first baby, usually they do a lot of their effacing before they do much dilating, because that cervix is never opened before, and there's usually a little more firmness to it. So if you imagine again pulling that turtleneck over the baby's head, a lot of times that cervix will efface significantly and then start to dilate. Now with a multip, the cervix is opened before. Sometimes they'll kind of do it at the same time. So the cervix, you know, in medicine and in labor and delivery, sometimes we go by the things that we can measure. And one of those is the cervical dilation. So remember the cervical changes that she has in early labor, those signal to us, oh, she's in labor, her cervix is changing. We also call her labor active labor when she gets to 6 centimeters. A lot of research and data has gone into that number. People used to say 4 centimeters, and you'll still hear that sometimes, but the new information in the current population is when she's about 6 centimeters, she's considered to be in active labor. We also look at labor in the first stage. We think of the first stage as being 0 centimeters to completely dilated. So again, once she's completely dilated, that's the end of the first stage of labor. And then let's see, what else was I wanting to tell you? Oh, I think what I'm going to do is, since we're running a few extra minutes here, we'll talk about bishop scoring in another video, just so they're not too long.